The COVID-19 vaccine is thankfully beginning to make its way into our pandemic-distraught world. Even though, as of the end of December 2020, it is not yet available to the general public, you most likely have questions. And we love it when you ask questions, because you know the recovery room saying, better knowledge leads to better decisions lead to better self-care, and better self-care leads to a better life. I'm cancer physical therapist Dr. Leslie Walke of the Recovery Room. This is video 1 of 3 we'll do on the COVID-19 vaccine. In this video number 1, we will discuss general topics about the COVID-19 vaccine and how it is made. In video 2, we will discuss the vaccine as it relates to people with cancer or a history of cancer. And in video 3, we will talk about the logistics of actually getting the vaccine. The info I share with you today is accurate as of December 30th, 2020, and the information is sourced by the U.S. Centers for Disease Control and Prevention. If you have unaddressed questions about your health and the COVID-19 vaccine, please go to your primary medical team or your medical oncology team, as they best know you, your disease history, your health history, and the facts. Yes, this vaccine was created with record-breaking speed. However, it was created safely and has gone through all these standard clinical trials and approval processes without cutting corners. What got it through the process so quickly was the unprecedented cooperation, planning, and financial support that surrounded the testing and production. It's kind of like this. If you want to build a house from scratch, it can take anywhere from 6 to 12 months to go from conception to build to inspection to move-in date. However, if somebody bought the land for you, handed you the financing, and the very next day the contractor, the plumber, the electrician, the builder, the carpenters, the roofers, and the decorators all showed up ready to go, you would have your house done and ready for inspection in a week or 2. That's kind of what happened with this vaccine development process. And it needed to happen like this because across the entire planet, so much is being disrupted, so many people are getting sick, and so many people are dying. The 2 vaccines currently available in the US are the Pfizer and Moderna vaccines. They both successfully completed phase 2 and phase 3 randomized placebo-controlled trials of more than 70,000 people and have passed all the qualifications and approvals that every other vaccine you've ever had has had to meet. So people taking this vaccine now are not guinea pigs. More good news. The results of these trials were thankfully spectacular. A vaccine result can be considered good when it is in the 50% effective range. These 2 vaccines are in the 90 to 95% effective range and are 100% effective against severe disease. These numbers are wonderfully stunning. So yes, this vaccine is safe and effective. Believe me, we wouldn't be vaccinating elderly people in long-term care facilities, the most vulnerable among us, if it weren't safe. And believe me, healthcare professionals are clamoring to get in line for this vaccine. That should speak volumes. Please don't let anyone freak you out or scare you by saying the vaccine was made with nanotechnology, because it was. The word nano simply means small. The world of viruses and vaccines are on a very microscopic level. But no, there are no microchips, no mercury, no heavy metals, no fetal cells, no tracking or tracing devices in the COVID-19 vaccine. Yes, this is the first time mRNA or messenger RNA has been used in a vaccine. But science and study of mRNA is not new and has been around for years. Prior vaccines without mRNA technology, like the flu vaccine, typically work like this. They don't use a live virus, but take a snippet or small piece of a virus and introduce that into the body by vaccine. The body doesn't recognize this snippet as something normal, so our immune system builds antibodies as a defense against it. So later, if that snippet again shows up in the body, but this time as part of a contracted virus, your immune system already has an attack plan for it and can kill it. Now, how the mRNA vaccine works differently is that instead of putting a snippet of the virus in the vaccine, they put in the messenger RNA. This teaches your body to build the snippet. In the case of the COVID vaccine, the mRNA teaches your body to build the spike protein on the coronavirus, and then our immune system builds an antibody defense plan to guard against it if it ever sees it again. So there is no live virus in the COVID-19 vaccine, so you cannot get COVID-19 disease from the vaccine. And also, because there is no live virus in the vaccine, you are not contagious to others because you just got the vaccine. And no, the mRNA has nothing to do and will not impact your DNA. Now here's an important point about people who are fully vaccinated against COVID-19. It is currently believed that if you breathe in the coronavirus from someone else who has it, if you're vaccinated, it will most likely keep you from getting sick. But the coronavirus may still be able to live in your nose and membranes for a bit of time. And if you exhale it back out into the air, someone else may be able to breathe that in, and if they're not vaccinated, they could get very sick. So until we reach a point where approximately 75 to 85% of our population is vaccinated, we are all going to need to continue to wear face coverings, wash our hands, maintain physical distance as we are doing now. We will most likely have to continue these safety precautions through the spring, summer, and possibly the fall of 2021. So to summarize, yes, this COVID-19 vaccine is safe and has gone through all the safety channels required of any other public vaccine. Yes, it is a very effective vaccine. This vaccine uses a messenger RNA to teach our immune system to build the spike protein, similar to that on the coronavirus, and to build antibodies against it. There is no live virus in the vaccine. And yes, we will all need to continue to follow the current safety guidelines of washing our hands, masking up, avoiding crowds, and maintaining physical distance for the foreseeable future. Oh, and one last question you may have is, have I gotten the COVID-19 vaccine? The answer is yes. I'm Dr. Leslie Walke signing out from the recovery room. Let's talk again soon.